Students, this is Shahada here, Department of Zoology, Maharani Science College for Women, Bangalore. In the previous sessions, we had discussed about the immune system and immune system reactions, that is, hypersensitive reactions. In today's session, we shall discuss about autoimmunity. Immunity or immune system itself is a complex system which is very well developed in case of vertebrates, which shows some of the defects, like if the immunity is too low, it can be termed as immune deficiency. If it is too much active, it leads to hypersensitive reactions, where a harmless substance from the outside environment can trigger hypersensitive reactions like allergies. And if the immune system is misdirected, or if it misleads the immune cells, which ultimately results in destruction of healthy cells, which is termed as autoimmunity. Moving on to the contents here. So we're going to discuss about the definition, types and causes of autoimmunity, definition and types of autoimmune diseases, common symptoms and treatment. Now let us see what do you mean by autoimmunity. Our immune system defends the body against infections and certain other diseases. It is made up of different organs, cells and proteins known as antibodies. These antibodies attacks and destroys germs and other foreign substances. Sometimes the immune system makes a mistake and attacks its own tissues and organs. This is called as autoimmunity. One such example for autoimmune disease is type 1 diabetes, in which the immune system destroys the cells in the pancreas that produce insulin hormone. So insulin is the hormone which regulates the blood sugar levels. So when the immune system mistakenly attacks the pancreatic cells which produces the insulin hormone, it eventually results in high amount of glucose levels in the blood, which ultimately results in organ death, tissue damage and the inflammations. So autoimmunity refers to the inability of the immune system to recognize its own tissues and cells as self. It is the failure of an organism to recognize its own constituent parts as self, which results in an immune response against its own cells and tissues. So any disease that results from such an aberrant immune response is termed as an autoimmune disease. So what triggers these autoimmunity? Autoimmunity is present to some extent in everyone and is usually harmless. However, autoimmunity can cause a broad range of human illnesses, collectively known as autoimmune diseases. Autoimmune diseases occur when there is progression from benign autoimmunity to pathogenic autoimmunity. This progression is determined by genetic influences as well as environmental triggers. So here I have a picture which shows number of triggers which can lead to autoimmune disorders or diseases. So let us see one by one. So one such factor is age factor. Age plays an important role or risk for autoimmunity, which occurs in the second half of the adulthood. When immune competence has declined and the production of T cells has ceased or stopped. So, when there is a less production of T cells in our body, it usually leads to the inflammations and the tissue damage in our body system. The next factor is the diet factor. Here, the change in food habits such as having lot of junk foods and other food habits which consist of lot of chemicals in them, which leads to the inflammation in our body system. Example, red meat which contains a sugar which is absent in human body, which upon absorption in the intestine which leads to the chronic inflammation. Next factor is genetic factor. Here, the genes play an important role in passing on the diseases in the families. Next is hygiene. Changes of lifestyle in industrialized countries have given rise to autoimmune diseases. Next one is the environmental factors, where climate change, stress, occupation, smoking, diet, chemicals and heavy metals which triggers autoimmune diseases. Next is gender. Most autoimmune diseases occur significantly more in women than in men. Again, the reason is unknown. So these are the different types of triggers which can lead to autoimmunity. Now, moving on to the types of autoimmunity. On the basis of pathogenic mechanism, autoimmune diseases are classified into three types. First is organ specific. So the name itself denotes here, it only affects a specific type of organ. Next is systemic autoimmunity. Here it is opposite of organ specific autoimmunity, which affects various types of organs, tissues and cells. Next is hemolytic autoimmunity. As the name denotes, it only affects the blood components. Now let us see in detail. So what is organ specific autoimmunity? So this autoimmune diseases is directed against a component of one particular type of organ, which is further divided into two groups: autoimmune disease mediated by direct cellular damage. Here you can have the cellular damage, that is lymphocytes. So this type of damage occur when lymphocytes or antibodies bind to cell membrane antigens, causing cellular lysis or inflammatory response in affected organ, eventually losing its function. Examples for this is Hashimoto thyroiditis, autoimmune anemia, good posture syndrome, insulin dependent diabetes mellitus. Next is autoimmune disease mediated by stimulating or blocking autoantibodies. In some cases, antibodies act as antagonists and bind to hormone receptor, stimulating inappropriate activity. This usually leads to overproduction of mediators or increased cell growth, which causes impaired secretion of mediators and gradual atrophy of the affected organ. Examples for this is Graves' disease and myasthenia gravis. Next is systemic autoimmunity. So it is the type of autoimmunity which affects different types of organs, cells and tissues, which is systemic type. Here it generates a defect in immune regulation that results in hyperactive T cells and B cells. Examples for this is rheumatoid arthritis, systemic lupus erythematosus, and multiple sclerosis. Next is hemolytic autoimmunity. It is a clinical disorder due to destruction of blood components. Autoantibodies are formed against one's own RBCs, platelets, and leukocytes. Examples for this is hemolytic anemia, thrombocytopenia, and leukopenia. Now, moving on to the causes of autoimmunity. So, earlier we had discussed about the factors which triggers the autoimmunity. Here, I have some of the mechanism which can lead to autoimmunity in our body system. Here, B cells, T cells, cytokines, and kinases have been identified as playing a crucial role in autoimmune diseases. And it is likely that autoimmune diseases does not develop from a single event, rather from a number of different events. Here I have listed out some of the mechanisms which can lead to autoimmunity. First is forbidden clone, second is altered antigen, third is sequestered antigen, fourth is immunological deficiency theory, fifth is genetic influence, sixth is hormonal factors. Now let us see one by one. First, forbidden clone. Here, mutation in the lymphocytes may result in the formation of changed or altered clone. These altered clone may recognize host as foreign and lead to development of autoimmunity. So some of the genetic disorders can lead to the autoimmunity. Next is altered antigen. Some of the antigens in the host get altered by chemical and biological or physical factors. So this is the environmental factors here, where some of the chemicals or the biological substances can alter the antigens in our body, thus leading to the formation of new antigenic determinants which may be recognized as foreign by the host. Next is sequestered antigen. Some of the antigen in the body are hidden from cells of the immune system. If the organs containing such antigen are damaged, which causes exposure of sequestered antigen, thus an immune reaction to these antigen may occur. So sequestered antigen is nothing but these antigens are hidden in our body. When such antigens are damaged, it causes exposure of sequestered antigen, thus an immune reaction to these antigen may occur. Next is immunological deficiency theory. According to this theory, mutation or loss of immune regulatory power, that is deficiency in immune system, results in a condition in which self-antigen behaves as foreign, which ultimately results in autoimmunity. So here I have a picture. For the autoimmunity, where the immune system misleads some of the immune cells to generate immune responses which recognize them as an intruder. So here some of the immune cells are recognizing its own cell as an intruder, where it generates a reaction against its healthy cell to destroy them. So such reaction is called as autoimmunity. So in this picture you can clearly get into your heads like what is autoimmunity. Next factor is genetic influence. Autoimmune conditions tend to run in families. Certain genes passed down by parents make some children susceptible to an autoimmune disease. Here, environmental factors such as viruses or sunlight then trigger an immune response in genetically susceptible individuals. When one individual in a family has an autoimmune condition, like for example vitiligo, other family members are then at an increased risk of autoimmunity. However, genetically susceptible individuals do not always go on to develop an autoimmune reaction or condition. So, next is hormonal factors. Autoimmune diseases tend to affect adolescent girls and young women, where certain female hormones may also play a role in when these illnesses flare up. Next, symptoms of autoimmune diseases. Symptoms of autoimmune diseases may be severe in some people and mild in others. So, I have listed out some of the common autoimmune diseases, symptoms of autoimmune diseases, which are fatigue, pain, and swelling in the muscles, connective tissues, and joints, weakness, skin rashes, ulcers, that is open sores that do not heal, recurring or low grade fever, dizziness, trouble concentrating, numbness, and tingling in the hands and feet. Next is swollen glands, abdominal pain, and digestive problems. Next is, what is this autoimmune disease? So, here B cells and T cells play an important role in autoimmune diseases. So, B cell is a type of white blood cell, or one of the main components of the body's immune defense system, which fights off infections and foreign bodies. In people with a normal immune system, B cells help to detect foreign antigens and produce antibodies to block them and render them as harmless. Now, T cells are another type of white blood cells that attack invaders in the body. But sometimes this defense system goes out of order, and instead of fighting against foreign antigens, the body sends out a cascade of immune reactions against its own tissues. This overactive immune response can lead to autoimmune diseases. So, we have clearly got like autoimmune disease happens when the body's natural defense system can't tell the difference between your own cells and foreign cells, causing the body to mistakenly attack normal cells, which leads to the autoimmune diseases. Now let us see what are the different types of autoimmune diseases. There are about more than 80 autoimmune diseases where some are well known, such as type 1 diabetes, multiple sclerosis, lupus, and rheumatoid arthritis, while others are rare and difficult to diagnose. With unusual autoimmune diseases, patients may suffer years before getting a proper diagnosis. So, I have listed out some of the autoimmune diseases here, like 14 of them. First is type 1 diabetes. So here the pancreas produces the hormone called as insulin, which helps to regulate the blood glucose levels. So when the immune system mistakenly attacks the pancreatic cells, it eventually leads to the high amounts of blood glucose levels in the body. So, which ultimately results in tissue damage, organ destruction, and inflammation. Here, I have a picture for the symptoms of type 1 diabetes. The first symptom is frequent urination. The patient may get frequent urination, and she may get excessive thirst, extreme hunger, extreme fatigue, blurred vision, sudden weight loss, irritability. So these are the common symptoms of type 1 diabetes. Next autoimmune disease is rheumatoid arthritis, which is denoted by RA. Here, the immune system attacks the joints of forearms and legs. This attack causes redness, warmth, soreness, and stiffiness in the joints. Unlike osteoarthritis, which commonly affects people as they get older, whereas rheumatoid arthritis can start as early as your 30s or sooner. Next is psoriasis or psoriatic arthritis. In psoriasis, skin cells tend to multiply too quickly. These extra cells build up and form inflamed red patches, commonly with silver white scales of plaque on the skin. Up to 30% of the people with psoriasis also develop swelling, stuffiness, and pain in their joints. This form of the disease is called as psoriatic arthritis because it also affects the joints. Here I have a picture for the symptom of rheumatoid arthritis, where you can have the normal hand having the normal bony structure with the phalanges. Whereas on the left hand side, I have a picture of rheumatoid arthritis where the hand is bit wavy or folded fingers they have, where you can have the inflammations which is denoted in the red color. So that is the main symptom of rheumatoid arthritis, which usually affects in joints like hands and feet. Next, I have a picture for the symptom of psoriasis, where you can clearly observe the silvery scales or the patches on the hands or feet, etc. Next is multiple sclerosis, which is denoted by MS. Here, multiple sclerosis damages the myelin sheath, which is the protective coating that surrounds the nerve cells in your central nervous system. Damage to the myelin sheath slows down the transmission speed of messages between your brain and spinal cord to the rest of your body. So that is the multiple sclerosis. Next is systemic lupus erythematosus, which is denoted by SLE. It is the systemic skin disease, affects many organs including the joints, kidney, brain, and heart. Some of the common symptoms include joint pain, fatigue, and rashes. So here I have a picture for the symptom of multiple sclerosis, where you can have the symptoms like fatigue, cognitive defects, vision defects, numbness, bladder and bowel problems, and mood changes and weakness. Here again I have a picture for the systemic lupus erythematosus, where I have a picture. You can clearly observe the rashes on the face, so which is the important symptom of lupus. Next is inflammatory bowel disease. It is the disease which is termed it is the inflammatory bowel disease, which is denoted by IBD, is a term used to describe conditions that cause inflammation in the lining of the intestinal wall. Each type of IBD affects a different part of the gastrointestinal tract, like mouth to anus or colon to rectum. Some of the common symptoms include abdominal pain, bloating, and diarrhea. Next is Addison's disease. Addison's disease affects the adrenal glands, which produce the hormones cortisol and aldosterone as well as androgen hormones. Having too little of cortisol can affect the way the body uses and stores carbohydrates and sugar. Deficiency of aldosterone will lead to sodium loss and excess potassium in the bloodstream. Symptoms include weakness, fatigue, weight loss, and low blood sugar. So here I have a picture for the symptom of bowel disease, which include rectal bleeding, abdominal pain, mucus in stool, weight loss, and persistent diarrhea. And here on the left hand side I have the picture for the symptoms for the Addison's disease, which include fatigue and lethargy, low mood or irritability, weight loss, and muscle weakness. Next is Graves' disease. Graves' disease attacks the thyroid gland in the neck, causing it to produce too much of its hormones. Here, thyroid hormones controls the body's energy usage, known as metabolism. Having too much of these hormones speed up our body activities, causing symptoms like nervousness, a fast heartbeat, heat intolerance, and weight loss. One potential symptom of this disease is bulging of eyes, called exophthalmos. Next is Sjogren's syndrome. Sjogren's syndrome. This condition attacks the glands that provide lubrication to the eyes and mouth. The hallmark symptom of Sjogren's syndrome are dry eyes and dry mouth, but it may also affect the joints or skin. So here again I have a picture for the symptom of Graves' disease, where you can clearly observe the bulging of eyes in the upper side. In the lower side of the picture, you can observe a normal thyroid gland which is pink in color, and surrounding that you have a blue color mark which denotes enlarged thyroid gland, which leads to hyperthyroidism, where an overproduction of thyroid hormone which causes enlargement of the thyroid, and other symptoms such as exophthalmos, heat intolerance, and anxiety. So these are the common symptoms of Graves' disease. And here I have a picture for Sjögren syndrome. The symptoms include dry eyes and also damage to eye surface and also dry mouth, where you can also observe increased tooth decay. Next is Hashimoto thyroiditis. In Hashimoto's thyroiditis, thyroid hormone production slows down, leading to deficiency. Symptoms include weight gain, sensitivity to cold, fatigue, hair loss, and swelling of the thyroid gland, which is called as goiter. Next is myasthenia gravis, which affects nerve impulses that help the brain control the muscles. When the communication from the nerves to muscle is impaired, signals can't direct the muscles to contract. The most common symptom is muscle weakness that gets worse with activity and improves with rest. Often, muscles that control eye movement, eyelid opening, swallowing, and facial movements are involved. So here again I have the picture for the Hashimoto thyroiditis. You can clearly observe here the symptoms like sweating, fatigue, goiter. You can clearly observe how the neck region has swollen, and they also observe the intolerance to heat, change in mood, and change in bowel movements. Next is myasthenia gravis, where you can clearly observe the symptoms like the drooping of eyelids, drooping of nose, and drooping of lips. So they may also observe weakness in the arm and leg muscles, and they may also have the symptoms like double vision and difficulty with speech and chewing. So these are the common symptoms of myasthenia gravis. Next autoimmune disease is autoimmune vasculitis. Autoimmune vasculitis happens when the immune system attacks blood vessels. So vasculitis, it usually pertaining to blood vessels. Here, the inflammation that results by narrowing of the arteries and veins. So usually it attacks the blood vessels, where it changes the size of the blood vessels by narrowing the diameter of the veins or the arteries, allowing less blood flow to flow through them. Next is pernicious anemia. This condition causes deficiency of a protein made by stomach lining cells known as intrinsic factor, that is needed in order for the small intestine to absorb vitamin B12 from food. Without enough of this vitamin, one will develop an anemia, and the body's ability for proper DNA synthesis will be altered or changed. So here I have a picture for the vasculitis, where the first picture denotes a healthy blood vessel where the size of the blood vessel is normal. Coming to the affected blood vessel, the diameter of the blood vessel has decreased, or it has become very narrow, which is the main and important feature of or the symptom of autoimmune vasculitis. Next, I have the picture for the symptoms of anemia here. You can clearly observe it. They may observe fatigue and low energy, increased heartbeat, shortness of breath, headache, dizziness, and chest pain. Next, the last one is celiac disease. It affects the small intestine. People with celiac disease can't eat foods containing gluten, a protein found in wheat, rye, and other grain products. When gluten is in small intestine, the immune system attacks this part of the gastrointestinal tract and causes inflammation. And here I have a picture for the symptoms of celiac disease, which includes weight loss, stomach and muscle cramps, numbness and tingling in the legs, tooth enamel loss, joint pain, weak bones, infertility, chronic diarrhea or constipation. Next, moving on to the treatment options for autoimmune disorders. Although there is no prominent cure for autoimmune disorders, standard treatments aims at reducing the signs and symptoms of the disease and restrict the autoimmune processes to reduce the intensity of damage caused by abnormal immune system functioning. However, doctors often prescribe immune suppressive medicines such as corticosteroids, pain relieving medicines are also effective in reducing bone, joint, or muscular pain. Autoimmune disorders associated with inflammations like rheumatoid arthritis can be treated with the medicines that target protein responsible for joint inflammation, such as TNF blockers. TNF is nothing but tumor necrosis factors. So, this is about today's session where we discussed about the autoimmunity in detail. So, we discussed about the definition of autoimmunity, types and triggers, mechanism or the causes. Then we discussed about the common symptoms of autoimmune diseases, and then types of autoimmune disorders with each of those symptoms and treatment. So thank you, students.